Okay, let's start your story, Michael. So, what you come to here?
About a year and a half ago, I originally came to you. I was driving on the freeway, listened to my Christian radio station, and that's where I heard you guys. And I think when you're in pain, you will search all avenues. I had shoulder and neck spasms that were probably almost a year and a half.
Mm-hmm. How bad was the pain? How bad was it?
8 and 9s.
8 and 9.
Yeah, on the 10 scale.
Okay.
So severe enough to have me drive on the freeway for an hour to get here,
Okay.
and to take the treatment. So that's what got me here, and that's what's keeping me here.
So you remember what happened in the first treatment?
Yeah, I remember having a little anxiety, a little fear about coming in here, but much better. I felt much better after the first treatment. The pain went down to a 3 and 4 level, and the most important thing is that the neck spasms and back spasms, were eradicated.
Okay.
From day
Normally you go to a doctor, they go through a whole bunch of tests,
Yeah.
and then send you a specialist. So how many
Yeah.
tests did I do on you?
Probably none.
What do you mean, probably? 0, okay?
Well, the thing I want to point out, before I came to you, I went to Job and Kirtland, and I was about ready, I was determining whether to have surgery on my lower back.
Who is Job Curlin?
It's a orthopedic surgeon in
Okay.
Los Angeles.
Okay. Is
And
he with the Lakers? Or
Yeah,
not?
yeah,
Oh, yeah,
yeah,
see,
yeah.
okay, yeah.
And for the L4 and L5, and again, you don't like to hear that term, but enough pain, and they want to prescribe 3 or 4 different drugs I've never even heard of.
Yes.
I was on about 1,600 to 2,400 milligram of Motrin a day,
Yes.
just to get through the day. And I'm happy to say,
Yeah.
I'm
I want to make a point.
medication free.
If you do an MRI now, what happened to L4-5 and C5-6?
Still there?
Same thing. You show totally no change.
Yeah.
Okay. But how's the pain now?
Minimal.
Minimal.
There,
Okay.
I have good days, I have bad days, but the bottom line is that it's manageable.
Yeah, only because you're stressed out. I mean, if you don't have the stress, and secondly, I don't think you're eating right. You still do not know about the heat and cold. That's so important. And alkalizing, you have heat, and you drink coffee 3 cups a day.
Yeah.
And that's why you're not healed.
You're trying to get me to stop my coffee.
Not stop, okay? Slow it down, okay? What else do you have? You have any pain anywhere?
Again, from the left side, everything on my left side has been either injured or had blockage in the past. So
Okay, so you don't feel much of it.
let me tell you what, just coming here and it's about managing. I'm able to go to hot yoga twice a week. I work out with a trainer on the off day, so that's 3 times a week. I'm able to stay active.
How about emotionally? You feel any different?
I do. I mean, the anxiety levels are so minimal today.
Remind me about the anxiety, because I can get it better. Most of upper part I treat it here, but the kidney down here, you didn't complain, but that's the anxiety.
Yeah.
Okay, yeah.
So, it's high stress living and job.
But I'm
employment.
enable you to enjoy life and do effective work.
Absolutely. That's why I'm here. You try the in-the-box thinking. Sooner or later, you'll go to the outside the box
Good.
thinking.
Thank you very much.
Blessed day.
Okay.